This is Dr. Goutham. Good evening, all. I'm a consultant nephrologist at Panimala Medical College in Chennai and a visiting consultant at RKK Medical Center, Korattur. Today, I'm going to deliver a small talk on CKD, the stages of CKD, common symptoms of CKD that patients present with, and the pedal edema, which is a very worrying symptom. Which scares most of the patients with the chronic kidney disease. So chronic kidney disease, by definition, it means that any changes in the anatomical or physiological or biochemical parameters of the kidney function, which extends for more than 3 months, that is referred to as a chronic kidney disease. So commonly, chronic kidney disease is caused by diabetes and hypertension in our country. And apart from diabetes and hypertension, other causes of chronic kidney disease are becoming more prevalent nowadays, like chronic kidney disease of unknown etiology, which is attributed to the climatic changes, the presence of heavy metals in the soil, the use of NSAIDs, the use of alternate medications like Siddha, homeopathy, or other types of native medications. So these and one more thing that is attributed to the chronic kidney disease of unknown etiology is the patients are like more patients with chronic kidney disease of unknown etiology are farmers, agricultural workers, miners, and those work in the very humid and hot climate that leads on to recurrent dehydration and subclinical acute kidney injuries, which accumulate to form a chronic kidney disease. So these are the common causes of chronic kidney disease in our country, and the common symptoms that patients present with chronic kidney disease is fatigue, which is of unexplained etiology, bilateral the leg swellings, frequent urination, frothy urination, and apart from that, it can also cause nausea, vomiting, facial puffiness, eyelids become very boggy. So these are the very common symptoms that patients usually present to a nephrologist. So the most common and very worrying symptom that makes a patient come to a nephrologist is the bilateral leg swelling, which is clinically called as a pedal edema. This pedal edema is caused by chronic kidney disease, and we have to rule out other causes like heart failure, chronic liver disease. These are the common other non-communicable disease that can attribute to uh, pedal edema. And the other that the other point that I have to emphasize is the stages of chronic kidney disease, which is range from stage 1 to stage 5. Usually, patients present with symptoms like, as I aforesaid, like those symptoms usually start when the patients uh, progress beyond stage 3. That is when the EGFR, that is the estimated glomerular function rate, filtration rate, falls below 60 ml per kg per meter square. So these symptoms are very common in stages with stage 4 chronic kidney disease and stage 5 chronic kidney disease. And This pedal edema is usually caused by chronic glomerular diseases, chronic glomerular nephritis. So these patients usually present with bilateral leg swelling, facial puffiness, hypertension, and urine analysis usually shows presence of RBCs as well as proteinuria. And what are the how we can find this kidney disease at an early stage is the very key to the treatment as well as prevention of chronic kidney disease. The main emphasis about chronic kidney disease is that it is better to screen early, detect early, and those patients who are vulnerable to chronic kidney disease, like patients who are more than 40 years, who suffer from diabetes or hypertension or heart diseases, and those like people who have already taken uh, native medications, or those who are those patients who frequently use NSAIDs. So these patients should be screened for chronic kidney disease. Uh, Chronic kidney disease can be easily screened by a few tests like urine protein examination, a urine protein creatinine ratio, an ultrasound abdomen to assess the size of the kidney, and a blood test to see for the serum creatinine levels. So these tests form the base of screening for chronic kidney disease. As like everyone knows, prevention is better than cure. So it is always better that chronic kidney disease is actually prevented, so that the progression of the disease could not be stopped once the disease has set. So it is always better if we detect early, we can at least slow down the process of progression of the disease, and the process of damage to the kidneys can be significantly altered by a few drugs like AC inhibitors and other few drugs on the pipeline, which are very helpful in decreasing the progression of chronic kidney disease. So thank you.